Our second presenter today is Jeffrey Martin, who's professor at Wayne State University. Jeff publishes in the psychosocial aspects of disability and sport performance, is current editor of Sport Exercise and Performance Psychology. So Jeff, we're glad to have you with us.
Thank you, Jerry, and thank you for all of you that have chosen to attend this, and thanks to Philip for inviting me and the rest of the NAK leadership. As you can see, I'll be talking about the determinants of elite disability sport performance. To give you an idea of the things I'll cover over the next 20 minutes, I'm going to talk a little bit about the disability sport athletes who I'll be presenting research on, and then tell you a little bit about the Paralympics, because many of the athletes who I'll be talking about and the research that's been done with them are Paralympians or high-level athletes that have competed in world championships as well as the Paralympians. I'll try to incorporate a little bit of information other than psychological information that hopefully will be of interest to those of you that are not from a sport or exercise psychology background. And the way in which I'll present the information is through a personal developmental model which talks about all the various factors that influence performance, but also highlights that sport psychology and sport psychologists are not only interested in performance, but the quality of the experience. The athletes that I'll be talking about today all have physical disabilities, so I won't be talking about any athletes with intellectual disabilities. I won't be talking about participants in the Special Olympics, for instance. Many students I find, and even adults who aren't familiar with the Paralympics or athletes who have disabilities will say to me, "Oh, you mean Special Olympians?" because they're familiar with the Kennedy Foundation, and that has, the Special Olympics has a lot of media attention. So many of the athletes will have spinal cord injuries. They might have cerebral palsy, vision impairments, amputees. So as I mentioned, most of the athletes are high-level elite athletes who have physical disabilities. The Paralympics, if you're not familiar with, is the second largest athletic competition in the world. It follows the Olympics in the same facilities, the same Olympic Village is where the athletes stay. It just comes on about a week after. The first official Paralympics was in 1960 in Tokyo with about 400 athletes. In 2012, the last Summer Olympics in London, there were over 4,000 athletes coming from over 160 countries. And every year, it gets more media attention, it gets more competitive, it gets harder for athletes from each country to make the national team, it gets more competitive, the times are getting faster, the distances that they jump further, so it's becoming more and more elite. One of the criticisms of the Paralympics a number of years ago was that even though it was the pinnacle of athletic achievement for somebody with a disability, that in many ways it still fell short of high-level, elite level sport performance. And that's changing every year. So instead of just telling you what sports they participate in and what types of disabilities they have and what they look like, I just thought I'd briefly show you some of these athletes. Don't mean to go really fast, but 20 minutes goes quick. Whoops, missed that one. Okay. So athletes with disabilities are in many ways very similar to any other athlete that does not have any type of disability. And in fact, even sort of dichotomizing them into with and without a disability is erroneous because there's kind of a continuum there. And the word disability includes lots of different disabilities, and within each disability there's various ranges of severity. And many disabilities are invisible. We wouldn't even know that a person might have a disability. The title of my presentation was Determinants. That's a bit of a misnomer. Most of the research in this area is descriptive, it's anecdotal, it's qualitative, it's correlational. It's not done in a way that we can really establish cause and effect. As I mentioned, I hope to present some research that's not psychology-based, so that will be of interest to those of you that don't come from a psychology background. The model that I'm going to use is this. And this particular model is a personal development humanistic model that was first articulated by Robin Veely and Steve Danish back in the 70s and the 80s, applied to all athletes, not just able-bodied athletes. And I've kind of transformed it to be a little more specific or a little more useful for athletes with disabilities. And as you'll see across the bottom row, the determinants of performance and the determinants of the quality of the athlete's experience is based on four things: foundation qualities, psychological qualities and skills. So foundation qualities would be something like self-esteem. Psychological qualities and skills would be the ability to focus and concentrate while you're performing a sport. Psychological methods are the techniques and the methods used to help develop the skills. So goal setting might be one example. And then finally, there are a host of factors outside of these other three, facilitative and debilitative factors that can influence performance. So quality of sleep, nutrition, lifestyle, those types of things. So I'm going to give you one example of a foundation quality research effort. Foundation qualities tend to be non-sport specific, such as self-esteem, and their influence on performance tends to be indirect. This is a study I did with the help of the Lakeshore Foundation that Jim mentioned, and it was based on the selection camp for the women's Paralympic wheelchair basketball team that then went on to win the gold medal. So it was 25 of the best athletes in the world who were from the USA, and they came to the final selection camp that would determine which ones made the Paralympic team and which ones didn't. And we were able to provide them with a personality questionnaire that's very similar to the Big Five factor, if you're familiar with that. And then we looked at mood state. And our hypothesis were that the athletes who made the team would demonstrate a more favorable psychological profile on personality characteristics and mood states. And if you look at the numbers in red, the rows in red, these were the two personality characteristics where the Paralympians were higher or stronger: tough-mindedness and anxiety or neuroticism. So they were stronger in tough-mindedness and lower in neuroticism. If you look at the mood states, you'll notice that they were higher in vigor, which is the middle red VG, and they were lower in confused mood states and lower in depressed mood state. This isn't clinical depression, this is just depressed mood. So on these particular 5 characteristics, the Paralympians were more favorable. Now, of course, a study like this can't establish cause and effect, but it did support our hypothesis that the athletes who made the Paralympic team and won the gold medal had some personal qualities and mood states that were probably facilitative of superior training and performance. The next study will focus on psychological qualities and skills. This is a quote from a Paralympian, and almost all athletes will tell you, yes, mental skills, the mental side of sport is important. It almost goes without saying now, but this is a particular quote from a Paralympic gold medalist. So psychological qualities and skills tend to have more of a direct influence on performance or quality, and they tend to be sport specific. So if you've heard of coping skills, psychological skills, mental skills, things like the ability to manage stress, to talk positively and limit negative self-talk, to set goals, to be able to focus and concentrate, to stay in the moment and not dwell on a mistake that you might have made 10 seconds earlier, or to not project into the future about the outcome of the competition. So these are the types of things we refer to when we talk about psychological skills and qualities. Again, with the help of the Lakeshore Foundation, we were able to test the Paralympic wheelchair rugby team. If any of you have seen a really nice documentary called Murderball, then you'll have a feel for the athletes that were in this study. But Murderball was nominated for Academy Award, and it follows the U.S. Paralympic team and they're a season long as they have a rivalry with Canada and as they end up eventually playing and performing in the Paralympics. But in this particular study, we were interested in determining if athletes with stronger psychological skills tended to be more engaged or enthusiastic and passionate about their sport experience. So the top 4 rows in blue represent this construct that refers to as engagement. So it's very much a positive psychology concept. It's the opposite of burnout. If you're high in engagement, then you basically are in love with your sport and what you do. You have high levels of enthusiasm, dedication, vigor, and confidence for your sport. The next row in red represents athletes' perceptions of their ability to engage in self-talk. You'll see there's 2 rows there: self-talk motivation, self-talk cognitive. Most sports psychology researchers have found that athletes use self-talk to motivate themselves and to maybe plan strategy to rehearse some type of cognitive element for their sport. The next 4 deep red lines represent imagery. Similar to self-talk, imagery can be used for motivational purposes as well as for cognitive purposes. Imagery is mental rehearsal, it's visualization, it's seeing, recreating, or creating with pictures in your head. And most of you probably heard of imagery. And then finally, the purple is a multidimensional set of coping skills. So it's athletes' perceptions of their abilities to manage stress, to set goals, to deal with pressure, to be able to concentrate in the moment. And mostly this was just to show you what we assessed. When we predicted engagement, we found that it was multidimensional coping skills was highly predictive of engagement. So the athletes that had better mental skills, stronger psychological skills for coping with the stresses of sport, with daily training, they were more passionate and engaged in their sport. I'm going to skip over psychological methods and go right to facilitative and debilitative factors. These are some of the things that are going to be more unique to athletes who have disabilities because they face a lot of different challenges that a person without a disability would not face when it comes to competition and training. Sean McCain, the head sports psychologist at the USOC, said, at the Olympics, everything is a performance issue. And for my purposes, just replace Olympics with Paralympics. And it's a notion that either directly or indirectly, almost everything that you do in your life can probably, at least has potential to influence how well you perform. These types of factors are both specific, sport-specific and non-sport-specific, and they can have a direct as well as an indirect influence on performance. So across the bottom, these are some of the examples, and I'm going to cover one from each area over the next few minutes. So before the Paralympics, athletes with disabilities often have to train by themselves in very challenging environments. So just imagine if you're a wheelchair marathoner and you live in Ontario. I'm from Ontario, I'm a Canadian, and it's the middle of winter and you want to go out and train. My background is as a runner. It was hard getting out there and training for the Olympics by myself on a February morning. So imagine what it's like if you have to take a wheelchair out, and in fact, in many cases, you can't because there's too much snow and ice on the sidewalks. There's reports of some athletes in Toronto who try to go on the side of the road and get killed. So it's horrendous. Trying to get into a facility, all of us, to some degree, might take it for granted, the ability to go to Lifetime Fitness, to Gold's Gym in the winter. Well, for many athletes who would like to go there and train, those facilities are inaccessible. And even if they are accessible, once you get in there, the equipment isn't real easily used, especially if you're in a wheelchair. And if you were able to use equipment, there's no guarantee you can get into the shower stall or get into the bathroom and use the facilities because the doors may not be wide enough for your wheelchair. There's few teams As Jim mentioned, many people with disabilities are underpaid, underemployed. There's more people with disabilities in poverty. They have fewer friends, less social support, higher rates of loneliness. So they're really facing a lot of challenges in everyday life, not to mention trying to achieve high levels of performance in a particular sport. So it's really hard. A lot of Paralympians don't have a coach. So not only are they training by themselves, but they're trying to coach themselves, and many of them don't have access to information. Now, it's a little better if you're from the UK or Canada or the USA, and in fact, Canadian swimmers are trained by the same coaches that coach the Olympic Canadian swimmers. So there's a huge range in the opportunities athletes have for getting coached by really good coaches who understand what it is to coach an elite athlete, who have a coaching science background, who understand exercise physiology. There's been a few studies come out lately looking at the role of effective coaching and how athletes with disabilities respond to that. So these are correlational studies where they're looking at coach behavior and then athletes' responses in terms of motivation, satisfaction. And this is just one study that showed that athletes who perceived their coaches as allowing them opportunities for autonomy or self-determination, that they tended to have stronger relationships with their teammates, and they had a stronger sense of control over their sport involvement. And this particular study came from self-determination theory, and the idea is that if you feel more in control with more in control of your sport experience, you're more likely to be intrinsically motivated and continue to be involved and continue to be committed. Traveling is difficult. So how many minutes, Jerry? 1 minute. Okay. So it's difficult to travel. Often, if you're in a wheelchair, you have to get on the plane first and off the plane last. So once you get to the Paralympics, it can be very stressful. I'll try to be quick with this study, but essentially what you're looking at is how much time athletes spend wheeling at different velocities between the first and the second half, and these are Paralympians. And basically what you see is the purple bar is lower than the rainbow bar at all velocities, which means these athletes are getting tired in the second half and they can't perform as effectively. So one part of sports psychology is simply making good decisions about training and things like conditioning. And so this would suggest that even Paralympians need to get fitter to perform better. Sleep. One study with Brazilian Paralympians showed that almost 3/4 of them had poor sleep quality in the Paralympic Village, and then those in turn had moderate to high levels of anxiety. A second report with British Paralympians reported poor sleep in the Paralympic Village was also a source of stress. This particular Paralympian, who's actually a renowned scholar at the Loughborough Center, at the Center for Disability Sport at Loughborough University, talked about the difficulty of having to live with somebody for 2 or 3 weeks who you may not like or get along with. Many athletes with disabilities have pain, and many of them use marijuana. But of course, in the Paralympics, you have to either get a waiver or you have to be sure that it's cleared your system, and you have to find another way to manage your pain. So that's an additional stressor that an athlete without a disability, or at least most of them, wouldn't have to deal with. Classification refers to the process of equating athletes across the severity of their disability. At a major competition, you do run the risk of getting reclassified and all of a sudden having to face what you might perceive as superior competition. And as you can imagine, that could really contribute to a lack of confidence. Finally, there are reports that athletes with disabilities, when they finish their career, they feel lost and they feel kind of left behind by the sport institution, and they're not getting the support that they would like to have in order to manage that transition into leaving sport. Future research directions, well, you could go almost anywhere because hardly anybody's doing research in this area. I mean, there's lots of sporadic studies here and there, but nobody systematically has really taken up the mantle, other than maybe a few scholars. Thank you. Sorry for going over a bit.